So right now, the two currently approved current used radiopharmaceuticals, meaning radium-223 and lutetium PSMA-617. There are some other bone-seeking betas that have been approved for a long time, just not used as much for bone pain. They are currently approved. Well, radium-223 is currently approved mostly as a single agent. I think most people think of lutetium PSMA being approved as a single agent, but the way the trials were done, they were both done in combination with best standard of care. So they don't have to be given alone. Most of that best standard of care was with hormonal agents, but with other agents, so they can be combined with certain drugs, although we think of them as doing all the kind of the work themselves. The way that they were also studied initially and initially approved is past most of the other standard therapies. So they both tend to be a little bit later lines of therapy, at least not kind of that frontline setting. And a lot of people give them alone, although I think it's justifiable to give them with hormonal therapy or some of the other agents such as steroids or anything else. Radium-223 was studied in the era where there wasn't so much abiraterone and enzalutamide, so it was given with older hormonal agents. We have done some real recent studies combining with the more potent AR pathway inhibitors, and that can be problematic if we don't do it carefully. So most of the time I think it's with that drug alone or with some older agents. About half the patients on lutetium PSMA-617 on the VISION study received a modern AR pathway inhibitor at the same time. This would have been the second or third one of these, not necessarily in the frontline setting. So I think it's reasonable to say, okay, it's okay to give with those, but it's also okay to give alone. So, this is so new. I suspect that for most physicians, they've prescribed this 0 times in the real world, and there's going to be a learning curve. But the point is that these can be given alone or can be given in combination. And then for both radium-223 as well as lutetium PSMA-617 and other similar drugs, I think the next step is to look at both more formal combinations as well as moving them earlier into the disease state paradigm.